3.
All right, so today I am going to demonstrate trach suction and trach care on your patients. So you're going to come in, okay, you're going to first verify your order, make sure that you have an order to be able to suction your patient. We don't ever suction just to suction, we want to make sure that we have a cause. So the 4 reasons for why we would want to suction our patient, okay, is if we have cyanosis or that blue discoloration, we hear audible rhonchi in their lungs, we see increased secretions, or we have a decreased pulse ox, okay? Those are going to be the 4 things I'm going to expect you to know during your test up process as to why we would want to suction our patient, okay? So you're going to come into your room after you've verified your order, and you're going to do your hand hygiene, don your gloves, you're going to come over to your patient, you're going to do your assessments, okay, involving your lung sounds. You're going to listen to the lung fields, make sure everything sounds okay. You're going to inspect the trach site. You're going to look to see if they have that increased secretions. You're going to look at their coloration, and you're going to make sure your patient is on a pulse ox and see what that actual reading is, okay? You're then going to make sure that you're checking your identification, so your name, your date of birth, and your allergies, and watching that against the armband, okay? Once you've done that, you're going to ask them if they're having any pain, because suctioning can be very uncomfortable for the patient. So you want to make sure that if they are having pain, that you are medicating them ahead of time so that they can tolerate that procedure. Once you know they're comfortable, once you know everything's good, then you can go ahead and actually suction your patient. You'll provide your privacy for your patient, okay? And you're going to make sure that your bed is at a good workable height, and that they're in a high Fowler's position for this. Okay, so that we do not have any aspiration during the procedure. You're also going to want to make sure that you have an ambu bag close, so that if they need those extra 3 to 6 breaths in between suctions, that you have that there for that reason. You're going to make sure that your suction is turned on to 80 to 150, and you'll bring your suction tubing close enough to you that you can attach it once you have everything set up, okay? All right, so once you do that, at this point too, you can take the dressing out for care, or you can wait. I'm fine with either one, okay? But I'm gonna wait until I go to start actual care, okay? Just because suction can be a little bit messy. You're going to make sure that you have your saline and your peroxide. This will be needed for care. This is what you're going to need for both care and suction, okay? You're going to take your lid off. You're going to make sure that the lid gets placed down like so you're not contaminating the lid. You're going to make sure that there is a date, initial, and time on here, and if you've used this before, that it is lipped, okay? At this point then, I'm going to take these gloves off. I'm going to do my hand hygiene, and I'm going to open up my kit, okay? Let me just take my rings off. Okay, so this is what your kit will look like. So within it, you're going to have your little container for your saline, you'll have your catheter, and you're going to have your gloves, okay? So when you're opening this, you're going to need to be extremely careful so that nothing falls out of the kit, okay? So I always, just to kind of see where the gloves are going to be at, which they're on the other side, so you can actually open this away from you, being very careful, and then close it back up to flip it to get to your gloves. Okay, so you can open that up. Okay, flip it, do your little pinch. This point then, this part can get ripped off. Being very, very, very careful. Okay, not to touch your catheter. Okay, so now you're going to go ahead and put your sterile gloves on. Again, being very careful not to put this wrapper over near your catheter. And you're going to glove up. can fix yourself if it goes on a little wonky. Okay, now you're sterile, you can adjust as needed, just being extremely careful though that you do not break sterility. Okay, so now you're sterile, okay? So at this point, you can just go to this, touch it in the middle, okay? You're gonna take your container out, being careful not to touch in the middle of it or in the center. It's not popping. There we go, okay? So you're gonna be careful not to touch in the center part here, and you're gonna put that on a clean surface. Again, making sure you're watching your gloves and it's not touching the table, okay? At this point, you're gonna pull your catheter out. You're going to wrap it around your dominant hand, okay? So when I wrap it, I kind of wrap it around my 3 fingers, like so, okay, to make sure you have control of the tip as well as control of the part that's going to attach to your suction tube in, okay? So once you do that, you can now contaminate this hand. You're going to take your saline, you're going to dump a little bit into your container, okay? You're going to come over here, okay? You're going to attach your suction tube in, again, being careful not to touch that against your catheter. It can touch that white port part only, okay? So now you're attached. You're gonna unravel. You're going to put your catheter into your saline and you're going to occlude your port and it should suction up through the catheter. That way you know that it's working as well as lubricating the tube, okay, or the catheter. You're then going to rewrap. Come over here, remove your oxygen source. This way, okay? You're then going to have complete control of your actual catheter here, or the tube in. You're gonna unwrap. You're gonna hold back about 2 to 3 inches from the end of the tube itself. And we're going to have control of your suction tube in. But do not put your thumb on the port until you're ready to actually suction. You're gonna take the tip, being careful not to touch it to anything else. You're gonna go down the center, and you're gonna keep advancing it until you hit resistance. Once you hit resistance, you're gonna pull back 1/2 inch. You're then going to occlude your port, and you're going to pull. Okay, and I do all my pulling with this hand, so I have control of this hand at all times. I'll show you guys one more time. So we're gonna go down till you hit resistance. We're gonna pull back 1/2 inch, occlude, and you're gonna pull with your non-dominant hand back, being careful not to touch the catheter against anything. You'll rewrap, replace your oxygen source. If they need the extra breaths in between, you can give them 3 to 6 breaths with the ambu bag. While you're suctioning, you don't want to suction any more than 10 to 15 seconds, okay? Because we don't want to cause them to not have that oxygenation. You can go up to 3 passes, okay? And in between each pass, you want to wait at least 30 to 60 seconds, okay? Longer, depending on if the patient needs it. If you see that they're not recovering fast enough, then you let them go a little bit longer before you go to suction them again, okay? Once you're done suctioning, you're gonna come over here. You're gonna put this back in the water, occlude your port to clean out your catheter of any secretions, okay? You'll then rewrap, and you can go down for another pass if you need to at this point. Or if you're done after they've done well with that 1 suctioning or 2 suctioning, you can come in and you can suction the nasopharynx. Okay, once you're done with that, you're going to wrap, undo your suction, turn your suction off, and then this will get wrapped up in your glove, like so, and you'll throw that away. Okay, At this point, they're usually going to have a lot of secretions. Whenever you suction a patient, they tend to cough a lot more. So a lot of secretions tend to come out, so then you need to do care. So if you do suction first, you can then go into step number 15, I believe it is, on your trach care checklist. So we're going to go into that next, okay? Let me just discard of this and get my kits, okay? So if you're coming in to do care, okay, you're going to obviously reassess from the suction in first, making sure that their lung sounds are sounding better, the secretions are better, their pulse ox is better, whatever was the reason for why you needed to suction them in the first place. So we're gonna re-listen to lung sounds, we're gonna look at that pulse ox, we're gonna look at their coloration, make sure they're tolerating everything okay from the actual suctioning before we officially go into care, okay? We're gonna make sure we document how they did before suctioning, after suctioning, the color, amount, consistency of the secretions that we got out while we were suctioning, okay? So we're getting ready to do care. At this point, like I said, you can take your dressing off at this point or later on, either way is fine. But you're gonna take that dressing off and you're gonna look at the color, amount, and consistency of the secretions that are gonna be on that dressing. This will then go into a red bin, okay? At this point, you're going to take your peroxide lid off. You're gonna make sure that it's date timed and initialed. If you used this before, you're going to lip it, okay? You're gonna take these gloves off and do hand hygiene and be ready to open your kit, okay? So, when we do this, we're gonna open this up and you're gonna take this entire lid off, okay? So you can discard of that, okay? You're gonna put that close enough to you, okay, that you can easily access everything, okay? But whenever you're doing stuff, you're not going over your sterile field. So what I do is I put my saline and peroxide, then my kit, then my sterile field, okay? And that's how I've always set it up. So at this point, your gloves are gonna be sitting in here freely. They're not gonna be in a package like you guys are used to. So you're gonna have to be extremely careful that you're only picking up the cuffed part when you're putting those gloves on. Because of the way my gloves are in here, I'm gonna flip this around for a second, being careful only to touch the outside part of the kit, okay? And I'm gonna pick up the cuff part and grab my first glove. Okay. And I'm gonna glove up. Like I said, if it goes on a little goofy, you can fix that later on. Okay, you're then going to pick up your next glove, being very, very careful. Not to break sterility, okay? So at this point then I can fix this glove. Now I'm sterile, okay? So you're gonna take out your sterile field and it's just gonna be like Foley catheter. You're gonna be able to touch all over this at this point because you're sterile. And you're going to open this up and put the shiny side down on your table, okay? You're then gonna take all the stuff out of your kit. So in this kit, okay, you should have multiple Q-tips. There should be at least 3. For whatever reason, I only have 2, so we're gonna use one of these pipe cleaners as my 3rd Q-tip, okay, for right now. You'll have some pipe cleaners. You're gonna have the brush that you're gonna use to clean. You're going to have your new dressing that will have the cut down the middle, and you're gonna have several gauze and your new trach ties, okay? So I tend to kind of just undo all of this to make it easier to grab what I need, but again, keeping it within your 1-inch border, okay? At this point now, you're gonna contaminate this hand, okay? So you're gonna take your saline and you're gonna mix the little container, part of the container will be all saline, okay? And the bigger part will be half saline, half peroxide mix. Okay? And again, being very careful when you're doing these, that you come around this way. That's why I put them on this side so you're not bringing it near your sterile field, okay? So now that's ready to go. Now per your checklist, it says at this point you want to take these gloves off and put on wall gloves, okay? Either way, I'm fine with you keeping these gloves on to come over and do what you need to do with the patient. I don't expect you to have to change gloves at this point, okay? So if you're looking at the checklist and you get a little confused, that's why, but just know you can keep these on, and that's one less glove change you have to worry about. You're gonna then come over to your patient, you're gonna remove your oxygen source, okay? You're gonna stabilize your faceplate like so. You're gonna squeeze on either side of your inner cannula, and you're gonna remove your inner cannula, replace your oxygen source, maybe, it's all twisted. Okay, and then you're gonna bring this over here and you're gonna drop it into your saline peroxide mix, okay? And you're gonna let that soak in there for a little bit while you now change out your gloves back to sterile, because you're coming back to your sterile field, okay? So, I'm gonna remove those. I'm gonna do good hand hygiene again. I'm just gonna move this for right now, okay, so nothing's in the way. Now, the day of test out, and while you're practicing, you can have a second table. I highly recommend having a second table so you have more room, okay? So what you're gonna do, okay, is sideways. That way you're not turning your back on your patient or your sterile field at any point in time. You're gonna put on your second pair of sterile gloves. Your top to fix it, don't ever reach under. Okay, so now you're sterile, okay? So at this point, you're gonna take your inner cannula out of the normal saline peroxide mixture. You're gonna take your brush and you're going to dip it into the peroxide normal saline mixture, and you're gonna take a step back. We don't ever wanna clean over your sterile field, okay? So we'll take a step back, you're gonna go from the bottom up, and you're gonna clean in your inner cannula like so, back and forth several times. You're then gonna take your brush and you're gonna clean the outside to make sure everything is nice and clean, okay? You're then going to pitch that, okay? You're then gonna come over, you're gonna grab one of your pipe cleaners. Oh, agitate it first, getting ahead of myself, guys. In just the normal saline, do a little tap. Now you're gonna take another step back and you're gonna dry inside your inner cannula. I usually do two just to make sure it's nice and dry. And you're gonna take a gauze and you're gonna dry the outside of your inner cannula, okay? Now, you're gonna put the distal part of the cannula in your dominant hand, and we're now gonna contaminate your non-dominant hand, okay? So we're gonna remove your oxygen source. This is very twisted. There we go. You're gonna stabilize your faceplate, okay? And you're going to put your inner cannula in. Now this is gonna be the really important part. So you're gonna push it down so that you do not contaminate your sterile hand. You're gonna put it to it's about right there. Careful that you do not occlude the entire trach. You're just gonna push it off to the side, like so, till you hear it click, okay? You're then going to replace your oxygen source. You're gonna come over here, you're gonna take your Q-tips, put them in your normal saline mixture only. We don't ever wanna use the peroxide at this point anymore because the peroxide is gonna dry out the trach, so we don't wanna do anything involving peroxide after this, okay? So you're gonna take your dominant hand, your contaminated hand, you're gonna remove your oxygen source. You're gonna stabilize your faceplate. You're gonna take the first Q-tip and you're going to clean from stoma out. Discard. Take the next one. Go down the middle, stoma out, discard. And your third one, stoma out, discard. You'll then replace your oxygen at this point because they're gonna probably need a few extra breaths. You're then going to take one of your gauze, put it in your saline, remove your oxygen, and you're gonna clean the outside faceplate. Okay, discard and take the other one and dry it off. Like so. Put your oxygen source back on. And at this point then you're gonna take your new dressing and you can touch all over it. Doesn't matter, it does not have to be sterile at this point. You'll remove your oxygen source and you're gonna line it up so that that slit is right in the middle of your trach, stabilizing your faceplate so that we do not decannulate your patient. You'll put up one side, stabilize the other side, and put the dressing up through, like so, okay? At this point now, you're going to grab a friend, okay? And you can verbalize this part of the test out. You don't actually have to do this, but you're gonna verbalize to me that you're gonna find a friend. That person's gonna be the one who's stabilizing the faceplate the whole time that you're changing out these trach ties. You're gonna take your new tie and you're gonna put it up through one side and around the other, okay? And then through, and then you'll remove your old ties. Once you do that, you wanna make sure that you can get one finger in between the trach tie itself, okay? And that the patient can move their neck with no issues and that they have that full range of motion, okay? After you're done with all of this, you're going to make sure that you reassess, again, lung sounds, okay, pulse ox, secretions, and you're going to document everything.